Guys, welcome back to Medical Coding with Blue. Today's episode is all about what do medical coders do and what are some of their tasks. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so this question comes from the audience. Some of the things that I'm going to talk about today, not every coder will do, depending on where they are. So this is just some of the more general tasks that we have as coders. I was asked if coders only code. For some coders, yes, that is all they do. They don't do anything else. And sometimes it is just because they're helping to kind of get that backlog squared away. And sometimes these are old records that they're going back through. So it really all depends. But for coders who work in a clinic on a daily basis, what they do is they run a lot of reports on how many encounters came in from the previous day, and that's usually how they start their day. If they're assigned to a particular clinic, let's just say podiatry, they'll run all of the encounters for all of the providers in that podiatry clinic from the previous day, and that's typically where they start working. For some people, they work in a queue situation. Everybody works from the same pot. So all of the encounters will go to a central queue, and a queue is just a list of people, or patients rather, and then they just sort of select the encounters from there, and that's how they start their day coding. So not all the things that we do are coding. What we also are responsible for is provider education. Sometimes providers are getting queried one too many times, so it is on the coder, or if you're in a facility that has a CDI, a clinical documentation integrity expert, you have to get with them to get the provider educated on what is missing from their documentation. Say, for example, if they are doing a lot of wound care and maybe they're not putting the measurements of the wounds and the depth of the wounds, that can be a problem because, we have to default to the lowest repair, and that's for some repairs, it's more complex than that. So it would behoove the coder and the provider to get together to make sure that everything is appropriately documented, because at the end of the day, the records and how they are documented is what is being carried forth with that patient anywhere they go. So it's important that the next provider who sees that record sees all of the pertinent information and all of the detail that should be there, and it shouldn't be a guessing game, and the provider shouldn't have to do additional studies to try to figure out what the last person did. So it's part of our responsibility to make sure that that's all in line, so we do education, so it's a lot of communication. Now, for some people, they just panicked. Don't panic. Again, it really all depends on where you are. Some places, they have somebody who does that education with the providers, and then for others, it's on the coder. And even if you're a brand new coder, it's okay. It's okay to do education with providers. Just make sure that you have all of your information that supports what you are telling them, because you don't want to go in there saying things like but you're not exactly sure. You want to be very certain when you go in there. That's just my advice anyway. So we do that. We do a lot of in-house education. If you are working for a hospital, sometimes they will have regular education that's not coding related, but it is hospital related. So all the employees have to go through it. Any kind of harassment training, they have to go through those types of things. If there's like fire drills and things like that, there's a lot of those. There's HIPAA as well, HIPAA training. So you have to make sure that you stay on top of those educational modules, and that's anywhere you go, because a lot of facilities have those in place to make sure that they know that their employees are trained very well on the guidelines for those things, because it all comes back to, preparedness. When Joint Commission comes in and inspects facilities, they want to make sure that the employees are going to be ready as well. So, that's why they have that continuous training, so that it's like second nature for these employees. So that's some of the other things that we do, some of that supplemental education. And then, of course, we attend, sometimes facilities may have in-house education for the coders that you can get CEUs from. At my facility, they do that. We have a coding class every single month where we get CEUs and we have to attend in order to maintain our knowledge and, of course, to get CEUs. But it's another one of the duties that we have. It's actually part of our standards that we have to attend these classes so that we are ready at any time for anything, you know. That's one of the other things that we do. And of course, we have to look at denials. If denials come in, we have to review the record and we have to review why the encounter was denied on the insurance billing side, and if it's legitimate. So when we get a denial in, the billing folks, because billing and coding can be two different tasks, or it can be performed by the same person, right? So it really, again, it goes back to the size of the facility. If it is a small doctor's office, it's typically the person who's doing the billing and the coding together. And if it's in a bigger place, then you have billers and you have coders. Any kind of denials that come in, the billers will send it back to the coders, and it is the coder's responsibility to review and see if this was a legitimate denial, or if it wasn't, then they have to be sure to put their reference, put how they got there, and why their code selections were supported. And so then you have to send that back to the biller, who has to resubmit it back to the insurance. So that's another one of our duties, and that does take time. The same thing like with working with audits. When you are, of course, working anywhere, some facilities will have audits every single month, and it's usually like a few months in arrears, so that way they can have enough data to work with when they're pulling these records to audit you. And it really all depends on the size of the facility. Again, it goes back to how many records they're going to pull. A lot of places don't pull the same amount of records. Some places will pull 10, some places will pull 30, some places will pull 50 in a month. So it really all, again, it depends. But you have to, when you get your audits back as a coder, you will look at your audits and see what was the auditor saying that you missed, or what was incorrect altogether. So then you have to look at those records again and review and see, was it something that you missed? Or maybe the auditor is wrong. And if the auditor is wrong, then you have to show your reference. And it has to be like an official reference, like for CPT assistant or coding clinic or something like that. It has to come from like the Merck manual or the guidelines. You know, it has to be something official that can support why you selected those codes. And then you go back and you mediate it with the auditor. And sometimes you meet with them one-on-one. Sometimes you meet with your supervisor and the auditor, and you all go over it together. So, and you make your point, you know, so it really all depends. It's not personal. These audits are not personal. A lot of people get offended when they're told that they are doing something wrong, or maybe they missed something and they take it personally. It's not personal. You know, some people try to make it personal, but it's not. When it comes to the compliance of a facility and the accuracy of the data that's produced in that facility, that should be paramount. You know what I mean? Like that's very, very important. When it comes to that, you have to have everything as accurate as possible. And yes, we are human. We do make mistakes, but we have to try to look after each other. And that's the whole purpose also of an audit, is to make sure that we are looking after, okay, we got to make sure everything's accurate here. And if the auditor is incorrect, and they're human too, so it is possible that the auditor may have counted you wrong, but you're actually right. But, you know, don't let that be respectful when you're telling them, and show them how you got to that. So that way, maybe you can win that one back. You should be able to win it back. But again, it all depends on the interpretation of the reference that you're giving back as well. So just make sure that you are prepared. All right. In some other facilities, you will be doing provider education. If there's not somebody already installed to do the provider education, like a CDI or, you know, somebody else, there will be education done by the coders. And usually when this happens, the coder, the way that I have always done it is I have always put together a slide deck that has 10, no more than 12 slides on it. And that includes the cover and the and the reference page in the back. So 10 to 12 pages in this slide deck. I typically talk for 1 hour, and you may think 10 to 12, that's not a lot of slides. No, it's not, because you have very limited time with these providers. And as it is, you don't want to overwhelm them with too many things. Even if they have a lot of problems in that particular clinic or specialty, you want to take the first 3 that are most important and focus on that, work on that, and then go to the next 3 on your list. So make a list of all of the problems that your providers are having. Maybe it's specificity in their documentation, or maybe it's laterality, or maybe it's missing parts of a detail in their procedure notes. I mean, it could be anything. So make your list and then focus on the top 3 things. Okay, so this keeps them engaged enough where it's not so much, it's not overwhelming. They don't have to have 50 slides like we do as coders, because whenever you notice when you're doing a course for CEUs, the slide decks are usually 50 or 60 pages. Sometimes they're over 100 pages. But we don't have to do that for providers. They're not trying to get CEUs from us. What they're trying to do is get education, and they need things right to the point. And a lot of people will take the slide decks and make them like writing. No, you have to make it bullet point. You have to get right to the point, and you have to make it as quick and as painless as possible on that page. So that way you can have plenty of time to discuss things. If you're just putting in, like, again, the bullet points, and then you can stop and talk about it, it's more open for conversation, and it's a little bit more of a fluid approach rather than, okay, here's all the things that we're going to read, because they're going to fall asleep. This stuff doesn't make sense to them as it is. So we have to really be careful with our approach. You want them to be engaged. And that's the best way, is to make 3 points that you're going to make and then talk about those. I always have the providers read to me, because when it comes to the slide decks, I wrote the slide deck. I know what I know. They don't know what I know yet. So I always have them read. And plus, it forces them to pay attention when it comes to, okay, we're in this class, because providers can sometimes fall asleep. I've seen them do it. I was not presenting, but I did see them fall asleep, and I'm like, this cannot happen when I do a class. So I'm going to make sure that they know that they're going to have to read to me. So they have to pay attention when they're called on to read. And I don't call on them. I tell them, I can either call on you, or you all can take turns. And they will take turns around the room, because no one wants to be called on, So I think that's the best way. At least it's just my opinion anyway. So the days of education when I perform provider education are my own personal favorite as a coder. I love those days, because when it comes to seeing that look on their face when they finally get it, it is the best thing in the world for me. And if you see that they're not asking you any questions during a class, don't be alarmed. This is an ego thing. Providers do not want to be put on the spot in front of other providers like they don't know something. Okay, they would rather you go to them in private, like when there's nobody around, like, or not a big group of people, and address their questions with you at that time. So that's why I always pay attention to their expressions and see if they're actually, if it's making sense to them, if it's clicking. And if I see that, then good. If I see a little bit of confusion, I will make a mental note of who looked a little confused, and I'll kind of talk to them on my own later on. And that has always been the best approach as well. That's just one of the things that I would recommend, but that's one of the things we do as coders, and I mean, other than that, it really does revolve a lot around coding, but it's not always production coding. As I said, you're dealing with the hospital side of education, then you're dealing with the coding side of education, and then of course you're dealing with provider education, and of course then you have your coding. And when it comes to coding, you're looking at different priorities. Sometimes for some facilities, they have it written out where which ones they want you to start with. They'll want you to start with like high dollar accounts that they know there's a lot of stuff going on, so it's very expensive. They want those to be coded and out of the way quickly, as quick as possible anyway. But there's that, and then there's doing, other ones like denials, and they'll have you work denials. And denials being if they came in from the insurance company, they want you to look at those fairly quickly so they can get those turned back around for payment. And then of course, then you're doing your regular coding. But again, it all goes back to whatever way they have it at your facility. So it's best to talk to them. Again, these are just some of the things that I do as a coder myself. I don't do billing. There's people that ask if I do billing. No, I have never done billing. I do know some things about billing because of my own research, but that's just because I have to know things. I don't like not knowing, and that's just my own personal thing. I don't like not knowing things. I would rather go ahead and do the research and figure it out rather than try to sit here and not know something. So, but yeah, that's just some of the things that we do. It's a lot of reading. So if you are one of those ones that, your eyes get tired, you do have to make sure that when you are coding, you do have to take breaks. At my facility, we get 2 15-minute breaks. We get a break in the morning after we've been there for at least an hour, and then we get a break in the afternoon, at least an hour after lunch. So you can't combine your lunchtime and your break times. But you do get to have 15 minutes to go and stretch and do whatever. Some people will go to the Starbucks and go get a coffee. I will sometimes get up, depending on what I'm doing. Sometimes I will get wrapped up into what I'm doing, or I'll take a stroll down into the clinic and see, how everybody's doing. I'll do that from time to time. And sometimes I don't do it, like, that's not my purpose. I'm like on my way somewhere and they just happen to see me, or they hear me coming down the hallway in my high heels, and they'll be like, oh, hey Blue, I have a question. So I'll go and answer that question. So it's about being available. They need to see your face. They need to know who you are. A lot of providers that come to me from other facilities have said that they never met their coder, that their coder was only an email. Like, they would get emails from the coder and then that was it. There was very little to no communication. And for me, that's a big no-no. I don't like that. I don't like coders that, go out of their way to avoid the provider. Yes, there are some providers that are very, very, very egotistical, and it is very difficult sometimes to be around personalities like that. However, it is your duty to take care of the patients for their information side. And that trumps that uncomfortable feeling of, oh gosh, I gotta deal with this provider. It trumps it every single time, because when I go back and I think about, okay, is this patient, and I need to make sure that their record is accurate. I need to make sure that it's complete and it has all the pertinent information. That's the way that I think about it. And when you think about it, not about yourself, but you think about other people, then that's when it takes that burden off of you and you're doing this for them. And so that's a little bit easier sometimes, I think at least, so, but yeah, and some of the more fun things, if your facility does this, some facilities do, some facilities won't. It all depends on their budget. But for some facilities, they will allow their coders to go to the national conference, or sometimes the state conference. AHIMA, the American Health Information Management Association, and AAPC, the American Academy of Professional Coders, both have their national conferences and their state conferences. And it's just a good way to earn. It's a good way to earn CEUs. It's a good way to network. It's a good way to share best practices from other facilities. Maybe your facility went over to a new electronic health record and you're trying to look for another facility that uses the same, that is having, that has some best practices to share. So that's always a good thing to to get when you go to these conferences. And plus, conferences are so awesome to go to. Again, you're meeting a lot of, your peers and other people. And if you've been to a few of them, like I have, it's like a big reunion every year that you go. I have not been in the last few years because of course, the pandemic hit. I only missed one other one, which was LA. I missed LA. I didn't want to go to LA anyway. But I like going to those conferences because you get to see and meet a lot of really interesting people. You learn a lot. And that's one of the perks of being a coder, I think. Some people may not like traveling. Some people may not enjoy that. I do. It's a nice break from the day-to-day and the rigmarole. And I think that, again, you being in a different environment helps to kind of like learn something new. You get to take information back with you to the other coders. Some facilities will send just a handful of coders. Some will send their whole department. It really all depends, again, on their budget. Some will just send two, and if you've been doing well, sometimes they'll send people who are well performing, in the clinic. And so they'll do that as a reward. But that's always the best thing. And I have always paid to go to conference. I have always paid to go to conference. But I do get administrative leave to go. And that's because it's like, that's where I'm learning things and it's work related. It's not that I'm going there for a vacation. But I am always willing to pay for my my conference ticket because to me it's an investment in my own education, and it's not about, well, the facility won't do this, the facility won't do that. It's not about that. The medical coding certifications that I hold are my responsibility. It's my responsibility to be able to maintain them as much as I can. Is it great when the facility will spring for those tickets? Of course. But if they don't, it's fine too, because it's my responsibility again, so. But that's it. That's pretty much it. And it's really hard to answer this question because, again, a lot of places are going to be different. Some, they say you don't talk to the providers. We talk to the providers. And for me personally, I don't like that. I don't like anybody talking to my providers but me. It has to be me, because the way that I see things, I'm the one who's coding for my providers, not anybody else. So if they're taking direction from somebody else and that direction happens to be wrong, and now I have to look at their stuff and their stuff is being documented incorrectly, meaning that there's not enough detail on there, or, whatever the case may be. And I'm having to go back in and inform them, oh, hey, wait a second. And then they're like, well, so-and-so said this, and then now you're saying this, so I don't know who to believe, so I'm not going to believe either one of you. No, we're not doing that. We're not playing that game. We are not playing that game. So everything goes through me. And I've made that very clear in my facility. Everything goes to me, because at the end of the day, it's my responsibility. I'm the one who has to answer for why they are either performing really well or why they're performing bad. I have to be the one to answer for that. No one else can, because they're, oh yeah, trust me. Anybody else would, be educating or whatever. They're going to pass that buck off. Oh, it's the coder's fault. No, I want to make sure that if they're going to learn from me. And it's going to be because I did my research and this is what I'm telling them. This is what I showed them. I have my slide decks and I have all of my handouts and my little helps, my little coding helps for them. My little coding helps are like just some things that I have like laminated, like the E&M tool. I have that laminated. I give that to them. I bought my own laminator. But that was me. That was a choice that I had. I'm not saying that you have to do that, but it was a choice that I made, okay? Because when I did try to get the the department laminator, all of a sudden everybody needed to use it. So, okay, I'll get my own then, And so that's what I do. But to me, that small investment is worth it because I don't have to waste time. And I'm not about wasting time. I'm about getting down to business. And here's your E&M tool. Here is, all of these things that can help you. And I laminate this stuff to give it to them. So that way, okay, I can see this and I can write on it. I can, do all of my things on it. Yes, because that's how they can make their notes. And I see all of those things up all around when I go around the clinic. And so it's good to know that they're using them, you know. Sometimes I will take a step back and see, you know, who needs what. I will also pay attention to, you know, how they learn. And when you do that, that makes you a really good coder, I think, because then you're paying attention to detail. And that's what it's all about. So anyway, I have chatted y'all's ear off. Okay, I'm about to wrap this up because I am going to get cut off here in a second. So yes, that is some of the tasks that we as medical coders do. And that's it. I'm going to go ahead and wrap this one up. Thank you guys so much. If this video helped you, please like, subscribe, and share. And I'll see y'all next time. Bye.